The girls and the women who have higher risk of PCOS will probably be the mothers and the sisters of other women with PCOS, families which have insulin resistance, or dad's got diabetes. Hello, I'm Dr Soji Swaraj. I'm a specialist physician. I'm an endocrinologist. So I consult here at East Sydney Private, but also the Integrated Health Institute in George Street. So we deal with diabetes, thyroid, hormonal issues, and my particular interest is metabolic syndrome, which affects almost 50% of the population. Polycystic ovarian syndrome is based on insulin resistance as the cause, and insulin resistance is a state where a genetic trait inherited from ancestors, and very often young women with PCOS will have a dad with diabetes or an ancestor with diabetes, but it means their insulin at the receptor level isn't working as well as it should. So from a very young age, the body has to compensate for their insulin not working so well by pumping out more insulin into the circulation in order to get their glucose into the cells. But the side effects of that high insulin level can be an effect on the ovaries, causing abnormal ovarian behavior, sometimes excess production of what we call androgens or male hormones by the ovaries. So in terms of symptoms of PCOS, the presentation for a lot of these girls to their GPs or their gynecologist or their endocrinologist is weight gain, irregular or absent periods, painful periods, sometimes it's facial acne, excessive body hair or thinning hair on the scalp. The girls and the women who have higher risk of PCOS will probably be the mothers and the sisters of other women with PCOS, families which have insulin resistance or chubbiness, or dad's got diabetes. In my practice, if she's noted to be particularly sporty or an ex-elite athlete, when they retire, I often see them manifest symptoms of PCOS. And so we've actually got a hypothesis that PCOS was beneficial. It's what got them into elite sport. Because of their insulin resistance, their high testosterone levels may have made them more competitive, stronger, more explosive, but then becomes a liability when they become sedentary. So the health risks associated with PCOS include the significant impact on her menstrual health in terms of the absence of periods, the fearfulness in terms of fertility. Sometimes they're told things about their fertility which simply aren't correct. There's a potential that if left untreated, she might require expensive assistance for fertility. But then of course there's also the cardiometabolic risk of the weight gain and the future cardiovascular disease and the diabetes. And of course, the insulin resistance and the weight gain is associated with an increased risk of certain cancers, such as endometrial cancer. PCOS can be mimicked by other diseases. And so we actually describe it as a diagnosis of exclusion. So when women present with lack of periods, the first thing we want to know is she pregnant? So pregnancy can mimic this, lack of periods, so we check a pregnancy test. Sometimes there's a condition called hyperprolactinemia, where the pituitary gland is secreting too much prolactin. That can turn off your period, so we always check for that as well. And an underactive thyroid can also mimic this as well. And finally, Cushing's syndrome is a disease with excessive cortisol, which can cause weight gain and the hirsutism as well. So when someone comes with possibly PCOS, we exclude all those others. First thing we do is look at lifestyle measures to lower the insulin. So a change in the diet, and see if cutting the cereal carbs and increasing their vegetable intake will decrease their insulin. And in combination, I prescribe a resistance dose of exercise, as if it's a drug. So I prescribe resistance exercise, 20 reps, 6 to 8 times a day. And an aerobic dose. We've all been told 10,000 steps, but no one holds us accountable to it. And often you'll go for days and days without exercise because they're busy. So I actually prescribe a daily dose of 10,000 steps or a 45-minute training session. Finally, I'll also say, if you're a sportswoman, get back to sport. Don't quit that. So medication options exist, and so for the forefront, alongside the resistance and the aerobic training and the food changes, I'll prescribe a very old-fashioned drug called metformin, a 100-year-old diabetes drug, which improves the insulin resistance, lowers the insulin levels, often will restore the periods to more regular, sometimes can help with the acne and the hair, but nearly always has a change in the menstrual pattern and helps with the resistance exercise to reduce the waistline.